Hello, my name is Lauren Bouts. I am a graduate student at the Colorado School of Public Health. My presentation, Echoes of Trinity, Advocacy, Justice, and Health in New Mexico, explores the profound implications of the Trinity test, the first nuclear weapon detonation, on environmental and public health in New Mexico. We will assess the causal links using established criteria, examine the extensive impacts on various populations, and discuss the broader implications for environmental justice and public health policy. This presentation aims to not only inform, but also to invoke a critical understanding of the historical and ongoing health crises stemming from nuclear testing. The Trinity test, ground zero for nuclear legacy. On the morning of July 16, 1945, in the Jornada del Muerto desert of New Mexico, the world witnessed the birth of the atomic age with the detonation of the first atomic bomb, known as the Trinity test. This explosion, equivalent to 24 kilotons of TNT, was so powerful that it could be seen and felt over 160 miles away, and a mushroom cloud reaching 7.5 miles high. Despite the visible and felt impact of such a massive explosion, the immediate public explanation was markedly different from the reality. The explosion lit up the surrounding landscape like daylight, and the shockwave was felt as a sudden jolt across a wide area. It created a half-mile wide crater, turning desert sand into a glass-like substance known as trinitite, scattered around the site. The U.S. military released a statement attributing the massive explosion to a munitions accident to maintain the secrecy of the atomic program. This misinformation was intended to prevent public panic and keep the development of nuclear weapons confidential. The truth about the nature of the explosion was not disclosed to the public until weeks later, after the atomic bombs were dropped on Hiroshima and Nagasaki in August 1945, which marked the public acknowledgement of nuclear weapons and the real cause behind the mysterious explosion in New Mexico. The initial risk assessments conducted during and after the Trinity test significantly underestimated the fallout, due in part to the rudimentary nature of radiation measurement and safety standards of the time. Early instruments could not detect the finer particles that carried radioactive material far beyond the immediate test site. Over the years, as methods evolved, so too did our understanding of fallout patterns and their health implications. Recent studies have provided refined data illustrating how radiation dispersed, affecting a larger population than initially thought. This evolving understanding helps strengthen the causal link between exposure and observed health outcomes, demonstrating a clear need for ongoing risk assessment. In looking at the Bradford Hill criteria of causation, there's strength of association. The incidence of health issues, particularly cancers, significantly spiked in populations close to the Trinity site, indicating a strong association. Consistency. Repeated observations by various researchers over decades show consistent patterns of health problems in these populations. Specificity. Unique radiation-linked illnesses such as thyroid cancer and leukemia are prevalent among the exposed populations. Temporality. The health effects followed the exposure, with data corroborating the timing of onset post-exposure. Biological gradient. Increased doses of radiation exposure were associated with higher incidences of disease, observed through direct measurements and retrospective analysis. Plausibility and coherence. The relationship between radiation exposure and health effects is well documented and biologically plausible, supported by animal models and human epidemiological data. Following the detonation, radioactive isotopes such as iodine-131, cesium-137, and plutonium-239 were dispersed across a vast area, affecting the soil, water sources, and air. This led to the bioaccumulation of radioactive materials in the food chain, exposing human populations to significant health risks. The misinformation regarding the nature of the Trinity explosion led to significant direct exposure through contaminated air, water, and soil, particularly affecting rural agrarian communities. These communities relied heavily on local environmental resources, which were unknowingly contaminated, thus exacerbating health risks over prolonged periods. The health impacts from this exposure have been severe and varied. The exposed populations have exhibited markedly higher rates of cancers, especially thyroid cancer and leukemia, directly linked to radiation exposure. Beyond cancer, exposed individuals have reported higher incidences of respiratory problems, reproductive issues, and psychological impacts such as depression and anxiety. Perhaps most troubling is the emergence of health effects that manifest decades later, complicating the linkage to initial exposure but increasingly recognized through longitudinal health studies of affected populations. The rural, agrarian, and subsistence living communities within the fallout radius faced heightened exposure risks due to agricultural dependence, contaminated water sources, outdoor lifestyle, lack of infrastructure and information, and economic and social marginalization. These factors made them particularly vulnerable to the environmental and health consequences of nuclear testing. Groups like the Tularosa Basin Downwinders Consortium, TBDC, have spearheaded the response to such widespread and differentiated impact. This grassroots advocacy organization has been instrumental in pushing for recognition, healthcare, and compensation for the affected individuals. The Tularosa Basin Downwinders Consortium engages in various efforts to help the community members who were affected by the Trinity test. They involve community members in documenting their experiences and health issues, which is essential to build a comprehensive case for recognition and compensation. TBDC also engages in persistent advocacy efforts to educate lawmakers about the impacts of the Trinity test. They strive for legislative amendments that acknowledge and address the needs of the downwinders. TBDC collaborates with academic institutions and health organizations to conduct research that quantifies health impacts and provides data that strengthens its advocacy efforts. TBDC raises awareness about the plight of the downwinders through public speaking, media engagement, and educational campaigns. They aim to foster a broader understanding and support for their cause. TBDC's main goal is to raise awareness about the people living downwind from the Trinity test site, who were exposed to radioactive fallout without their knowledge or consent, also known as downwinders. The organization advocates for comprehensive health coverage and screening programs to address the high cancer rates and other diseases prevalent in these communities. Additionally, TBDC lobbies for downwinder inclusion under the Radiation Exposure Compensation Act, RECA, to compensate affected individuals. The Radiation Exposure Compensation Act, RECA, of 1990 compensates individuals who suffer from health problems due to radiation exposure from atomic weapons testing and uranium mining. However, it initially did not cover those affected by the Trinity test. Advocates for the Trinity downwinders have pushed to amend RECA to include them, proposing to extend eligibility timelines and increase compensation. These changes are essential for justice and acknowledging the government's role in public health crises. The ongoing efforts to amend RECA have recently seen significant advancements, illustrating a vital connection between past advocacy and current policy making. Senate Bill S-3853, also known as the Radiation Exposure Compensation Reauthorization Act, aims to extend and enhance the original RECA. The The bill includes provisions for expanding the scope of the Act to cover additional victims of radiation exposure, including those affected by the Trinity test. The bill has received substantial support and has passed the Senate. It is currently under consideration in the House of Representatives, and a decision is anticipated soon. This amendment is not only significant for those who are directly impacted, but also for establishing a precedent in the United States. It sets a standard for how the country acknowledges and rectifies historical environmental injustices. The approval of this bill would represent a major triumph for the downwinders and a crucial leap forward in addressing the long-term public health effects of the U.S. nuclear program. Collaboration between researchers, community members, and policymakers is critical in improving risk assessment and devising effective public health strategies. Such partnerships can help conduct accurate exposure assessments and design interventions catering to the specific requirements of affected communities. This, in turn, can inform future policies based on comprehensive and contextual data, meeting the current health challenges while building resilience against potential environmental and occupational hazards. Towards a resilient future, the path ahead. Comprehensive health monitoring programs should be established, and medical facilities equipped to treat radiation-related conditions should be expanded. Environmental remediation projects should also be implemented to mitigate ongoing exposure risks. These are the proposed solutions to address the impacts of radiation exposure from the Trinity test. Community members should participate in health studies to better understand the impacts of radiation exposure. Policymakers should also consider legislative changes that include Trinity test impacts in RECA. Finally, healthcare professionals should engage in independent research to support health claims related to radiation exposure. By working together, we can better protect individuals and communities from the impacts of radiation exposure. In conclusion, it is important to acknowledge that the legacy of the Trinity test is a complex narrative that has significantly impacted our society. Through this presentation, we have explored the multifaceted issues arising from this historical event, highlighted the need for comprehensive solutions that address health and environmental justice. As public health professionals, it is our duty to advocate for policies that acknowledge and rectify past harms while preventing future ones. Let's take the lessons learned from this event and use them to foster a more just and healthy future for all. Thank you.